This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Lawley. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements. Hello, everybody. Welcome to Daily with Doc and Becca, and it is Pharmacist Fridays. Let's go ahead and open up that waiting room and let people in, as we do have people piling up as participants that are live here with us on Daily with Doc. If you would like to join us live, make sure that you go to the website, dailywithdoc.com, sign up for that newsletter so that you can also get the link to join us live Wednesday, Thursday, Friday from 12 to 1 p.m. Pacific, 1 to 2 Mountain, 2 to 3 Central, 3 to 4 Eastern. If you're in South Africa, I believe it's 9 to 10. So anywhere in between, you are welcome to join us here live. If you want to just catch us on the live stream, go stream.dailywithdoc.com or live.dailywithdoc.com. The live.dailywithdoc is going to take you to our last broadcast that we did here on our show. Now, this show is for educational purposes. We are a resource for an amazing community of individuals that have just a passion to help others find a better health journey. So if you were referred to this program by somebody specific, make sure that you get back with them, as they are the ones that cared enough about you to share this information. So care enough about them to say thank you. And they're going to be your primary goal, primary point for questions. Now, just want to welcome everybody to Pharmacist Fridays on Daily with Doc. I am your host, Becca Dukes. I am a certified naturopathic practitioner, certified holistic health coach, and also the director of student services for the Institute of Holistic Health. And each week we are teamed up with Pharmacist Ben Fuchs, who is a nutritional pharmacist, formulator, and a world-renowned educator, to uncover the powerful science-backed ways that we can take charge of our health, which means, folks, we are empowered individuals. We do not have to be chained or a victim or even captive to a system that is wanting to manage poor health. So you are in for a treat, as we are going to be taking your questions here on Pharmacist Friday with Pharmacist Ben. And I just want to welcome to the screen with me Pharmacist Ben Fuchs. Pharmacist Ben, I have missed you.
I've been here. What are you talking about?
No, but I have not.
Oh, you haven't been. You haven't been. Okay. Well, nice to see you again. How was your training?
My training was fantastic. I actually learned some communication skills.
Are you using them? Are you using them?
I am using them. Yes.
Can you give us one tip?
Well, one thing we need to do, folks, as individuals, empowered individuals, is watch the way we talk to ourselves, because ourselves are listening.
That's very good. That's very, very
So
good.
if we're talking negatively to ourselves, that's what our bodies are
You know,
going
it's,
to deliver.
do you know it's impossible, absolutely impossible to be depressed or have any kind of negative mood if you don't talk to yourself in a depressed or negative way? It's impossible. So anybody out there who's depressed or in a bad mood, change the voice in the head and you will immediately change your depression or whatever your negative mood is. Immediately, instantly. And also notice, this is also, Rebecca, this is tricky too, and I've studied this a lot, so I'm glad you said that. Also notice how, even though with 100% guaranteed, the best antidepressant is changing your voice, better than any drug, better than any other strategy, but notice how there will be a resistance to doing that. Even though you know that you'll change your mood instantly, you will find yourself resistant to doing that. Either you'll do it for a second and then you'll go back to the old way, or you'll deny it. You'll say that doesn't work, but there'll be some kind of drive to maintain your negative mood, and you'll have to override that with intention and volition and tremendous amount of desire. But if you do, it's impossible to have a negative mood. Absolutely impossible. And you can all test this right
now. Well, I want to add to that. One, don't claim my depression or my anxiety.
Yeah.
Don't claim it. It
Don't
is
own
not
it.
yours.
Don't identify with it.
Don't identify with it.
Yeah, that's right.
And two, depression is merely having questions that you don't know the answers to yet.
Yeah, that's
whether
good.
We're feeling overwhelmed, trying to figure out how do we get out of it, there's always a way out. And the way we speak to ourselves is the first step.
That's right. And oftentimes, I had this with myself. I noticed my mother's voice in my head many, many years ago. And I had to, and my mother, her way of motivating was to be negative, and you can't do it, and like that kind of thing. And I had to literally kick my mother's voice out of my head. Literally. I had to say, you have to leave now. And as soon as I did that, this was about 30 years ago or so, as soon as I did that, I noticed a sense of freedom. But yeah, I had to literally tell her to leave my head. And I'm no knock my mom. I love my mom, but she didn't, that was what I was implanted with. I'm sure many people out there can relate to that.
Oh, absolutely. It's those voices in our heads that keep us captured in a state that is not ours to be in if we don't want to be in. And another thing, Pharmacist Ben, you know, all of us have experienced trauma of some magnitude.
Right.
How many times are we going to repeat that trauma and make ourselves live through it every time we mention it, rather than letting it go and move past it? So that was another big thing of what
Carl Jung said, famous psychiatrist, turn of the 20th century or late 1900s, he said that the object to an effective life, the goal of an effective life, is to make the unconscious conscious, so that the drives that are making you do things, you become aware of them. And so all the things you're talking about here, and sometimes in the world of self-help and personal development, sometimes we have these kind of glib things like to do this, to do that, but we have to recognize that there's unconscious drives that keep us locked in to certain things. And the goal is, when you see that that something's not working, or there's resistance to change, to see what's lurking underneath, or to examine what's lurking underneath that you're not aware of. It's in the dark that's affecting your conscious activities and disempowering you. There's always something lurking underneath there. He called it the shadow. And the shadow oftentimes, actually, I hope we're okay talking about this. The shadow oftentimes is projected outwards when we don't own it, when we feel like it's not us. My shadow, for example, is incompetence and laziness and feeling sorry for yourself. That's my shadow. So what I have to know is I have to love that part of myself. Otherwise, I'm going to be projecting it on other people, and I'm going to be seeing it everywhere. It'll be all over my life until I own it myself and acknowledge that's part of me. And I have to actually integrate it. And by integrate, means recognize it, see it, acknowledge it, and actually love it. Love that aspect, because we all have all these aspects and we disown them because we think they're bad and we put them on everybody else. So when you see somebody you don't like, somebody that irritates you, somebody has qualities that you find offensive or repulsive, turn it around, look inside, and see if you're disowning that aspect of yourself and putting on somebody else. If you notice that, recognize it, because it's just part of being alive. Everything just wants to be acknowledged and recognized and loved. All aspects of us, just like all people, want to be recognized and acknowledged and loved. I hope we're okay talking about all this. I know we're here.
Well, yeah, we're here to empower and help others. But the one thing that you mentioned about, we want to be loved. We have to love ourselves
100%,
first
100%. Everything
before we can truly accept the love of somebody else.
And you're going to find, until you love yourself, you're going to find people all over you that don't love you until you love yourself. And then once you love yourself, it won't matter. And ironically, that's when you'll start to get the love that you deserve once you love yourself. It's all an inside job. It's an inside job. Successful life is an inside job. And that gets us back to health. We want to put our health, the responsibility for our health, on authorities, on other people. And that's why almost every time I'm on this show or somewhere when I'm talking, I say the number one goal of a healthcare professional, a real healthcare professional, is to get out of the way and give the power back to the patient. And that's why I go out of my way to make sure that the mechanisms are understood. And it's not that complicated. Instead of speaking in assertions, do this, do that, or giving you Latin diagnoses, just tell people how this stuff happens so people can take the ball and run with it themselves and empower themselves.
And one thing we want to remember is, our negative story may get us attention, but not the attention you want.
Yeah, that's right. That's right. All right. Well, that's good.
Well, there was a lot that we got out of it. I think it was absolutely worth the time that we took to go. So I went with my partner. Ivan says, thank you, Pharmacist Ben.
Ivan, to your part, you didn't tell me that. Okay, gotcha.
Yeah.
Okay, gotcha. So I'm glad
we had a great time of growth all the way around, and then topped it off with family, and able to meet up with my oldest, his 3 girls, get my my next youngest son, his daughter, meeting her cousins for the first time, and just had a fantastic week.
Very cool. Good for you. I'm glad you got to go.
Yes, right. Now it's time to get back to work.
Let's get back to work. Let's take some questions.
But it's not work when you love what you do. So, folks, if you've got questions for Pharmacist Ben Fuchs, make sure that you raise that hand. If you're live here with us, if you're out on any of the platforms like Rumble or YouTube and you're watching us live, you can type in your comments, as I have an amazing co-host crew that are watching for those comments, bringing them into the program, because we want to make sure that we are answering the questions that you have when it comes to health and being able to claim wellness for yourself and others. So, Pharmacist Ben,
yes.
The first question that we have is wanting to know your take on antibacterial everything. There's antibacterial soap, there's antibacterial sanitizers, there's antibacterial hand sanitizers and sprays. What do you think?
Remember when you were a little girl, Rebecca, and people go, "Oh, germs, germs." That was the big word, germs. There's germs everywhere. Get rid of the germs. That was the big thing, right? Bacteria got perceived as something that were germs and bad and causing problems and diseases. And it was antibiotics that were really, they were the good guys. They were the white hats, and the germs, the bacteria, they were the evil ones. Well, it turns out the vast majority, 97%, 95% of germs, or bacteria, more appropriately, are good for us. They help us make nutrients in the body. They help us make nutrients in the world. They out in the real world. They detoxify substances in the body. They detoxify substances. The vast, vast, vast majority of these microbes, single cell organisms, are good. They're beneficial, and they're all over our bodies. And this is why one of the silliest things you could do is use triclosan, which is the antibacterial soap. Now, if you really want antibacterial soap, the best kind of antibacterial soap is going to be alpha hydroxy acid based. Alpha hydroxy acids are also known as fruit sugar acids. Folks who are in the skin business or not in the skin business necessarily, but who are connoisseurs of skincare know good and well that alpha hydroxy acids can be used to smooth the skin, soften the skin, stimulate collagen production. The most famous one, by the way, is called glycolic acid. And if anybody wants to, you know this, Rebecca, but I don't know if everybody realizes this, but my specialty is dermatology and skin. And if you go online, you'll see all kinds of stuff where I talk about skin. And, I always include nutrition when I talk about skin, but sometimes I just talk about topical skincare. One of the most important topical skincare strategies for anti-aging the skin, for addressing things like hyperpigmentation or dark spots or blemishes, are these fruit sugar acids that are found throughout nature. They're found in every single cell of the human body. In fact, you can't make energy without these molecules called alpha hydroxy acids. They go by names like lactic acid, which people know about it as being found in milk. Famously, Cleopatra used to bathe in milk, sour milk, because of the lactic acid content. Old wives' tales tell about using lemons and oranges for your skin. Those are high in citric acid, for example. Malic acid is found in apples, and tartaric acid is found in grapes. The most famous of the alpha hydroxy acids is glycolic acid. And just a real quick story. Glycolic acid was first, I knew about glycolic acid from pharmacy school, but it became very popular in the mainstream at the turn of around the 1990s, early 1990s. And I don't know if you remember this, Rebecca, or some of the gals when you were young ladies and young girls. Glycolic acid revolutionized skincare, topical skincare, because for the first time, the average person home could have tools that you used to have to go to the doctor's office or the salon in order to leverage and employ. For the first time, you could have that for the comfort of your own living room or comfort of your own bathroom. And that was glycolic acid, and it completely changed how skincare is done. So if you want antibacterial topicals, alpha hydroxy acids are the best way to go. The most common antibacterial ingredient in soap is called triclosan, and it's a big problem because it's indiscriminate how it kills bacteria. Bacteria on the skin are extremely, extremely important for keeping the skin healthy. And things like fluoride in water and chlorine in water, antibiotics in water, not to mention antibiotics or antimicrobials in soaps, all conspire to kill the good bacteria. Now, eventually, bacteria will come back, but there's really no need or purpose for an antibacterial soap, none at all. There are now, believe it or not, you may know this, Rebecca, there are probiotics in skincare products. And those are just as silly as antibacterials in skincare products, because probiotics and the microbiome on the skin is constantly dying and being born again, so to speak. It's constantly in turnover. And so replacing them with a probiotic topical, which is kind of like, it's getting a little bit passé at this point, but for a few years, that was kind of a hot thing, a hot ingredient to put into skincare products. That's just as silly as trying to kill bacteria, because of how flexible the microbiome, bacterial population is on the skin and inside the body as well. So long story short, I wouldn't mess around with triclosan or antibiotic, antimicrobial cleansers or soaps or skincare products.
So a lot of them have a very high content of alcohol.
Not the soaps, but there are cleansers, yes, that have a high content of alcohol, and that's
sanitizers.
Yeah, the sanitizers and such. That's obviously to kill things. And killing things is really not a great strategy when you're talking about living tissue, whether it's inside the body or outside the body. Now, the skin's a little more forgiving because the surface of the skin is made up of a very hard protein, like your fingernails. It's kind of like a very thin layer of fingernail on the surface of your skin. It's called keratin. And the tippy top of the skin, which is called the stratum, means layer, corneum, which means hard, literally hard layer, is hardened by this keratin protein, which functions as a barrier. So you're not going to you can't do too much damage topically with topical ingredients and topical products. Nonetheless, if you do it enough, eventually something's going to get through, and that can cause a problem.
Okay. Well, Pharmacist Ben, I know you were on Coast to Coast.
I was. This
week, and we had some questions come up, and including people that are asking for the food diary newsletter, which I am excited to say that if you go to criticalhealthnews.com, sign up for the email list, you will receive an email with the food diary, or it might be an automatic download that you can download. Haven't decided. I don't remember what they've decided to do on that, but you can get a simple food diary that helps you track what you're eating, but not just track what you're eating, track how your body is responding to what you eat. So with that being said, we have another question coming from a listener, and he is 75 years old.
Okay.
He lost his spleen 25 years ago after an accident.
Okay.
He now has high blood pressure, which started soon after the accident.
Okay.
And his real question is, how can I purify my blood from leaky gut and keep my blood pure
That's a great
without a
question. Yes.
spleen?
The spleen's job is to filter the blood. That's that red blood cells in specifically. So yes, I could see without a spleen how you'd have a problem. The spleen does a lot of things. It helps fight infections. It's part of the immune system, actually. Stores white blood cells and so-called platelets, and it's a reservoir for extra blood. It's a very important organ, very underappreciated organ, and the main reason for having the spleen taken out is from damage. Athletes or football players especially will have sometimes have their spleen removed. There's a guy, I forgot his name. He's a quarterback for the Broncos, and he ended up getting his spleen removed. And it usually happens with trauma. But you know the answer to this question. How do you clean the blood? Well, first of all, how does the blood get dirty? In order to know how to clean the blood, you got to know how the blood gets dirty. And there's only two ways the blood gets dirty. And when I say dirty, I use that term because it's just graphic and it kind of it creates an image in your head. But really, it's hypercoagulable blood that has a tendency to clot. And this is what creates all the difficulties. There's no chronic degenerative. I said this on Coast to Coast. I say it all the time here on the Zoom calls. There's no diseases, chronic degenerative diseases, without first having dirty blood. They're all dirty blood related, with the possible exception of a local infection, maybe. But even then, it's not going to become systemic unless it's in the blood. It's the blood that's going systemically from head to toe. It's what's distributing everything. So logic tells you that. And again, this is all about logic. We want to get it out of our head that we're not capable of understanding this. You need a degree. You need to have a medical diagnosis. None of that is true. It's all there to disempower us. It's all about the blood. Everything's the blood. Life of the flesh is in the blood. So how do you clean the blood? Well, first of all, the only two ways the blood gets dirty is through injection. If that's the case, don't inject. Even if some medical professional tells you might catch a cold if you don't get an injection, it's not a reason to inject. That's number one. Number two, the second way things the blood gets contaminated or hypercoagulable is obvious, because it's the only way things get into the blood from a natural standpoint. Injection, it's true, but you have to go out of your way to inject. The main way things get into the bloodstream is through a leaky gut. Before I go into explaining that, let me say there's now in the news lately, and this is not a recent phenomenon, it's becoming more and more known, that a third way that things get into the blood is, do you know, Rebecca?
Well, there's inhalation, there's injection, and there's digestion.
Through the gums, through the mouth. And that's now being recognized as another way that the blood can become dirty, and it's being associated with heart disease. So that's another thing, it's through the gums. But for the most part, it is digestive system related. And when you think about it, of course that's going to be the case, because look at how we eat. And I can't tell you the amount of times people will call me up and say, but I eat really well, but I have all these health challenges, but I eat really well, and what they mean is they eat really well based on what the doctor told them, or what the internet told them, or what a list of foods that they saw or they heard about, only organic, only vegetables. If you have a chronic health challenge, assume you have a problem at the level of the intestine. Just assume it. And so that's why the food diary is so important. And I'm so happy that Jonty got to motivate to put it online, because it's kind of confusing, the whole food diary thing, what you exactly do. So anybody who's dealing with chronic health challenge, go to criticalhealthnews.com, sign up for the newsletter, and download the food diary. So the food diary is so important because it will show you the foods that you think are good, possibly, are causing reactions. There's the FODMAPs food, for example. The FODMAPs foods include things like bananas and avocados, and typically good foods. Then there's the histamine releasing foods. things like leftovers and also bananas. And there's other foods that are histamine releasing foods that you would think are good foods, but they could be problems. So you got to do a food diary, and you got to isolate specific causes to the effects. And by effects, I mean your symptoms. And you'll know if you have a skin symptom, it will get worse when you eat certain foods. If you have a digestive system, it will get worse after you have certain foods. And the skin and the digestive system, by the way, are the two most important indicators of that you're eating the wrong substance. But also pain can be exacerbated by eating the wrong foods. You'll notice, some people will notice that after they eat certain foods, they get more arthritis pain, for example, after they eat certain foods. Or if they've had some kind of injury, they'll notice the injury pain flares up after they eat certain foods. Or scoliosis and other kinds of inflammatory health conditions will spike after certain foods. So be vigilant and don't try to remember with your memory, because you forget things and things go under the radar and you don't notice them. And the way the brain works is it turns down the dial on things that happen regularly and only notices things that happen once in a while. So if you've had a problem with beans your whole life, you're not going to notice it until you start writing things down. It also helps to fast first. If you fast for a day or two, things that are problematic will become more profound and obvious and dramatic, and you'll notice them more clearly. So that's why to hit the reset, I call it hitting the reset button with a fast for a day or two. And that can also help. So for the gentleman with the spleen, get yourself a food diary, start to notice symptoms associated with specific foods. And that's step number one. Step number one is to notice the symptoms. Step number two is to eliminate those foods. You're going to eliminate those foods. Now, for some people, it's going to be a lot of foods because the intestine has been so inflamed and so attacked for so long that almost everything, and there's a lot of people like this, almost everything they eat causes digestive health issues. If that's the case, it's a little trickier. Find one or two foods, just stick to those, and eventually you'll be able to tolerate more and more as you straighten out, as you correct the health of the intestine. Then there's working on the intestine itself. Now, I know I've said this before, but it's just another graphic image that you can think of. The intestine after you eat food is not a pretty place. It's gooey and it's dripping and it's brown and it's got all kinds of living creatures, and it's just yucky. If you have a leaky gut, all that stuff, or at least some of that stuff, where's it going to go? Into the blood. So you got a problem there, obviously, because the blood is the sacred space. Not only is it delivering everything to the tissues, including food, nutrients and oxygen and detoxifying, but it's also going to end up delivering whatever kind of waste is getting into the blood through a leaky gut. That's a problem. Now, the body will compensate with hypercoagulation with clotting, and that's another issue. But in the meantime, that toxicity is going to initiate an immune reaction in the blood, which you do not want to have. Also, the clotting, not only is it going to impair delivery of nutrients and oxygen and slow down detoxification, it's also going to damage the vessels. The vessels are the blood vessels are tubes. And as that blood becomes sticky and sludgy and it's not moving as effectively, and there's immune cells in there and immune activity, the inside lining of the vessels is going to get damaged, and that's going to further impair blood flow. All of this is going to cause the blood to not move correctly, and the brain's going to turn up the pressure, and then you're going to have essential hypertension, and that's going to lead to even more problems. And all of this is coming from the gut. It's all starting from the intestine. And so, in addition to eliminating problem foods, you now want to restore bacterial balance. That's the next step. And I have a wonderful product here. I got to find it. It's on my desk somewhere. Where it is, right here. It's called Oh, you can't see it.
26.
I-26. You see it? There you go. I-26. This is specifically designed to kill bad bacteria. Anybody who has a chronic health challenge, particularly if it's associated with a digestive issue, I-26 kills the excess bacteria. Bacteria, the microbiome that we all know about, mostly is in the large intestine. It's not supposed to be in the small intestine, a lot of bacteria, because the small intestine is where you have a lot of food. The large intestine, you don't really have a lot of food, but if you have a combination of food in the small intestine plus bacteria, they will go to town. They'll have an all-you-can-eat buffet, and they'll start to secrete all kinds of toxins and nasty gases. They call them outgases, literally, and molecules like histamine and aldehydes and pieces of their cell membrane and cell wall called LPSs, that lipopolysaccharides, that wreak havoc on the immune system. In fact, just LPSs alone account for a tremendous amount of chronic health challenges, particularly female health issues like endometriosis and fibromyalgia and reproductive issues and menstrual issues, and God forbid, reproductive cancers as well are associated with these LPSs. So straightening out the dysbiosis, dysbiosis is the technical term for messed up gut bacteria, with your I-26 and then probiotics. And by the way, if you have this condition where you have a lot of bacteria in the small intestine, they call it SIBO, small intestinal bacterial overgrowth. These days, most people have heard of SIBO. 10 years ago, that wasn't the case. Just another reason why you don't want to just follow the conventional orthodox medical wisdom about health, because they don't know about things until 10 or 15 years later. And in the meantime, they're going to just take out your organs and say that, oh, you must have heard that from that quack pharmacist Ben on your Zoom call. And 10 or 15 years later, they'll say, oh, yeah, you know, maybe he was right. We're already starting to see that, by the way, with things like Parkinson's disease, which Doc and myself have been talking about as a digestive health issue from day one. Now they're saying, oh, yeah, you know what? Maybe you're right. Don't wait for them to say, oh, what? You know what? Maybe you're right. Use your own logic. In any case, what I was going to say is if you start to take probiotics while you're dealing with SIBO, sometimes your symptoms will get worse. I don't know if you ever heard this, Rebecca, where people will take probiotics and they'll notice that all of a sudden they're bloating more, they're uncomfortable more. That's a sign that they're putting more bacteria into a system that's already got too much bacteria. So it's a good, if that happens to you, it's a good idea to get yourself on the I-26. And there's also essential oils too, by the way, like neem oil and peppermint oil, oregano oil, which we have some great essential oils at Longevity. I think they actually buy them. I think they get them from doTERRA, if I'm not mistaken.
No. Oh my goodness, no.
Don't they get it from some real high quality company?
Not there. Actually, our quality is 3 times better
Where
and
do
more
they
pure
than
than
what
what you just.
I remember they got them from
Ancient Legacy.
But where do they get them from? They get them from some real high-end company. I forgot which one it was. In any case, essential oils, a couple drops of essential oil and water, or with your Beyond Tangy Tangerine before you have your meals, that can help kill excess bacteria. I'm sorry, on an empty stomach, not before you have your meals, but on an empty stomach. And then also there are strategies for strengthening the lining of the leaky gut, the intestine. Before I get into those strengthening strategies, I should tell you 3 interesting causes of leaky gut are obviously the foods like gluten and lectins and specific foods that inflame the gut, but also, interestingly, fried fats and processed fats are inflammatory for the gut. So French fries can be a cause of leaky gut. We all love our fried fats, and those can be a cause of leaky gut. For women, estrogen can be a cause of leaky gut, and also women should understand, in pharmacy school, we used to call estrogen, without being obscene, we used to call it the S-show hormone. You can use your your brain to fit.
Use your imagination on that. Yeah, use your imagination on.
Yeah,
use your imagination on that.
Because it is an S-show. It's very inflammatory, and I always, I don't say get a kick out of it, but it's always interesting to me how people think that they should be taking estrogen as they get older, as if estrogen was some kind of panacea, and that's a whole nother story about the estrogen fraud. But in any case, estrogen that's not cleared out appropriately can inflame the intestine. And ironically, estrogen is processed in the intestine by bacteria called the estrobolome. Have you heard of this, the estrobolome? Rebecca, have you talked about this? The estrobolome?
But I don't know.
The estrobolome is a complex of bacteria that process estrogen. So when you have dysbiosis, you're not going to process estrogen correctly, and that can cause issues with leaky gut. And then the third reason why leaky gut that can inflame the intestine are deficiencies in fatty vitamins, especially vitamin A, which again is ironic because of all these nutrients are absorbed in the intestine. So once your intestine is messed up, you got a big problem. Patching up a leaky gut by using fat-soluble vitamins, by balancing out estrogen or helping your estrogen, improving elimination of estrogen with things like more fiber, supporting the estrobolome, your ultimate enzymes, because of the bile in the ultimate enzymes. Bile salts can help you process estrogen. Essential fatty acids can help you act like estrogen. They're not going to help you process estrogen, but they can act like estrogen. So working on estrogen for a woman, that's another strategy. And then there are nutrients you can take to strengthen the gut. I love the Fucoid Z for that reason. The Fucoid Z is a polysaccharide that helps strengthen the mucosal lining of the intestine. And underneath the mucosal lining of the intestine, you have connective tissue. So building the connective tissue with collagen peptides, with the healthy bone and joint path, with the glucogel caps. That's another strategy for dealing with a leaky gut. And then there are the blood cleansing strategies. Fucoid Z can act like a blood cleanser. Glucogel caps can act like a blood cleanser. The ultimate enzymes taken on an empty stomach, particularly the bromelain in there, can act like a blood cleanser. Nattokinase, which is found in our nightly essence. And there was another product, AJ, you told me that had nattokinase in it on one day. I forgot what that was. That's another blood cleanser. And
Niacin Plus.
What? What was it?
Niacin Plus.
Niacin Plus. I was surprised that it was in the Niacin Plus, but that's another one. And then also, there are strategies that you can use that improve blood fluidity, the movement of the circulation of blood. Oxygen will improve blood fluidity. So practicing slow, deep breathing techniques can help improve blood fluidity. Activating the diaphragm acts like another heart. People have heart disease, people have cardiovascular problems, high blood pressure. Using the diaphragm can be an important strategy, and diaphragmatic breathing also activates the vagus system, the parasympathetic nervous system, so it has a relaxing effect. More water can help dilute the blood. Your ultimate EFAs have a blood thinning effect. And I forgot to mention this, but one of the great strategies for cleaning out the blood is something called chelation. And there are nutrients that act as chelating agents. For example, your ultimate MSM acts like a chelating agent. Your Selenium FX, it's called Selenium FX, the ultimate selenium acts like a chelating agent. One of the best blood cleansing chelating agents is right here in your BTT. Plant-derived minerals will act like a blood cleansing agent. So these are all incredibly effective strategies that you can use for everybody who has a chronic degenerative disease, none of which you are going to hear from your MD. None of these. In fact, a lot of them will laugh, or they'll say there's no evidence or something along those lines. Just use your logic. All of these strategies for cleaning the blood, for straightening out or correcting dysbiosis, patching up a leaky gut. These are all the things that you want to do if you have any chronic health challenge by virtue of their ability to smooth out and clean the blood. And by the way, this is especially true for autoimmune diseases, which the medical folks will tell you have no cause except for genetic, or that there is no cure, meaning you'll be on this medicine the rest of your life. Not true. When the blood circulates, the connective tissue and the soft tissues become dumping grounds for toxins. And these dumping grounds, these toxins that get dumped into the connective tissue and the soft tissue initiate immune reactions, and that's where autoimmunity comes from. So all these strategies are especially important and extra important for people who have autoimmune diseases. And the last thing I'll say is, if you notice that when you fast, you feel better, you can rest assured that you're dealing with dirty hypercoagulable blood.
All right. Well, everybody, I hope you're taking notes. And if you're not, it's great that we have the replays of all of our shows where you can find them by going to stream.dailywithdoc.com, or even on our website. We have links that will help you find our programming. Now let's go right over to AJ and we have hands up with questions, Pharmacist Ben. So AJ,
we don't leave people hanging. I'm looking for my stuff here.
What question are you bringing in today, AJ?
I got two questions related to eyes, but they're really not related to eyes. They're really downstream from the eye issues, but we're going to start with the eye. CJ, who is likely in our Zoom chat, has had dry eye syndrome in both eyes.
Okay.
And he as well has some pain in the eye, but his real acute problem right now is kind of spots or kind of like light sensitivity. He's got like
Yes,
blurred vision,
yes.
spotty thing. What was noted and kind of a clue to me, they noted some tear duct issues, and also in his history, he's had some benign type of cysts in his history.
Benign cyst where?
Throughout his body, other places in his body, not the eye.
All
But
right.
he mentioned to me that he had a J&J jab.
Okay.
So what
Well,
might
leaving
you?
aside the J&J jab, while it may not seem like it, all disease is cell disease, and all cell disease is preceded by dirty blood. So this gentleman doesn't have an eye problem, he has an eye cell problem. He doesn't have a tear duct problem, he has a tear duct cell problem. It's all about the cells. So when you have tear duct issues, typically you're going to have inflammation in the tear duct. Inflammation in the tear duct is due to disturbances at the level of the cell. The fact that this guy has cysts also tells me that there's stuff going on in his bloodstream. The two major sources or causes of dirty blood are what we just said, leaky gut, and also glycation. That is the sugaring effect that occurs in the blood itself and in the vessels. Remember, the tear ducts are vessels. They're like little tubes, microscopic as they may be. They're little tubes. And like all parts of the body, the tubes are lined with cells. Once those cells become damaged, the tube being so tiny, it's so microscopic, it's very easy to clog the tube. That the tube can be clogged with old cellular material, cell debris, inflammation, but it can also be clogged with, believe it or not, stones. You can actually have tear duct stones. There are also immune diseases that can affect the tear ducts and can affect all the fluid ducts, particularly an autoimmune disease called Sjogren's disease. And Sjogren's disease is often behind dry eyes and
Which
eye
they
problems.
said he didn't have.
Okay, well, he didn't. She doesn't know. He hasn't been diagnosed with Sjogren's disease. That doesn't mean he doesn't have it.
The doctor said he didn't have.
That just means that the doctor said, that doesn't mean anything. Sjogren's disease is a name. Just because you don't have the name doesn't mean you don't have the biochemical problem. The name is in the old days, they would knight you. You are now a knight. You're a holy man. They have a sword and they put it on your head. The modern way of knighting people say, you now have Sjogren's disease. Boom. It's like a knight. It's like that's the official thing. This is what they do. They diagnose. One of the hallmarks of this kind of medical treatment or these health strategies we're talking about is your diagnosis doesn't matter. What matters is the chemistry, not the name. The name is a brand name that the medical model owns. I can't say this will take care of your Sjogren's syndrome. I can't say, here, use this and you'll have your Sjogren's syndrome reversed. I can never say that. But I can say that this will, you can use this and it will clean your blood. I can say that. You can use this and it will address blood flow, or it will address dysbiosis, or it will address dysglycemia. Don't worry about the diagnosis. Worry about the biochemistry. Our medical model focuses on clinical chemistry, the chemistry of the clinic. Oh, you made this, you met this criteria of 120, you're a diabetic. You're at 119.99999. No, you're perfect. You're fine. This is ludicrous, really, when you sit and think about it. So you go by the biochemistry, not the name. Biochemistry is distinct from clinical chemistry. Clinical chemistry is the chemistry of names, the chemistry of test scores. That's their world. The world of the patient is not the clinic. The world of the patient is the biology. Our world is biological. It's not clinical. That's their world. But you know what? If we go into their world, we're going to get treated like we're part of the clinic. That's what we're taking pains to explain here, is that this is biological, not clinical. So whether he's been diagnosed as such or not, that doesn't mean anything. I don't know that he has an autoimmune disease, but I want to know some other symptoms. Remember, Bob Ross, I need some symptoms. I need some data points to be able to figure out what he's got. Nonetheless, for the dry eyes, the most important nutritional strategy is fats, especially your ultimate EFAs. The eyes are lined with a coating of fat, and that coating of fat is what traps the moisture. So using omega fatty acids as well as fatty vitamins is the strategy for addressing dry eyes directly. However, if he has a metabolic issue, that has to be addressed too. And as Rebecca will tell you, dry eyes are one of the symptoms of metabolic syndrome.
Syndrome.
And so are cysts. So there's a very good chance that this gentleman is, or whoever it was, is dealing with glycation issues as well as inflammatory and immune issues, and that has to be addressed too. And then, of course, if there's any digestive health issues, that whole explanation that we gave, half hour ago for the last 20 minutes or so, that has to be addressed too.
You're the man. And what causes AMD? This is
AMD
Olivia.
is just another silly medical diagnosis, macular degeneration. Now they have it distinguished. They call wet macular degeneration or dry. Nonsense. It
Okay, wait.
doesn't matter.
So she's saying she's progressed to wet AMD. She's taken eye vitamins faithfully, and she starts injections next week with her retinal consultant. What
Okay,
can she do?
I don't know what the injections are, but here's the thing. What are eye vitamins? Without knowing what we're really doing, it's kind of like the blind leading the blind, no pun intended here. It's like, what really are eye vitamins? What does that mean, eye vitamins? They're great, but that's not really what's going on with the macula. The macula is in the center of the eye, and it's responsive to pigments. Pigments are fatty. Reds, blues, greens, especially reds and oranges, but all the pigments are going to play a role in how well we see in the macula. And over time, as the impact of nutritional deficiencies kicks in, we don't absorb our nutrients, we don't get our nutrients, and the macula, which is subject to forces, electromagnetic forces, obviously, into the eye, becomes susceptible to damage. So what you want to do for the macula is, number one, you want to take certain things, which this gal's taking some eye vitamins. I have to see what it was specifically she's taking, but you want to make sure you're getting pigments too. And the pigments come from, well, you can get pigments. We have a product called the Ultimate HGH. What's it called with the pigments? I forgot what it's called. They keep changing the names on these things. There's a product that we have that has a bunch of pigments in it. It's a powder, and they used to call it Ultimate. Dude, I forgot. I keep changing the names and I keep forgetting the names.
Well, we do have one that has all the fruits and vegetable colors.
Powders, right?
There may be pills. There may be pills, but
there may be pills. But okay, there used to be a powder, and I forgot what it's called. But that's one way is to get pigments. But another way to get pigments is to get your pigments from vegetables. And how do you do that? Well, you got to eat the vegetables, but you want to braise your pigments or your vegetables first to release those pigments so that they're easy to absorb. The next thing is to make sure you're absorbing correctly. And if you have leaky gut and inflamed intestine, chances are you're going to be dealing with malabsorption issues. And if you have a liver issue and you have a gallbladder issue, or you don't have a gallbladder, again, chances are you're going to be dealing with absorption issues. If you're fat, so you got to correct absorption issues. So it's great to take vitamins, eye vitamins. That's awesome. And we have the Occutive and we have the Vision FX, and that's awesome. But if you're not absorbing, then you're not going to get the benefit of what you're taking. So you got to work on intestinal health as well. So macular degeneration is degeneration of the macula. The operative term is not macula, it's the degeneration. That's the key, is that your macula is degenerating. And in a way, macular degeneration is arthritis of the macula. It's the degenerative process. That's how we age. And I make that joke about MBFA disease, but really what I'm saying is it's just degenerative. We're degenerating. I said I call it my body's falling apart disease because it's just cute, but really what it means is we're deteriorating. Our body's degenerating and deteriorating. And it's like if you have a business, if you have a business and you're making money, they say you're in the black. If you're losing money, they say you're in the red. You're always spending and making money. But if you spend more than you make, you're in the black. If you make more than you spend, you're in the black. If you spend more than you make, you're in the red. When we're degenerative, we're spending more than we're making. We're always making and spending. Your body's always breaking down and building up. The breakdown process is called catabolism. The buildup process is called anabolism. And catabolism, breakdown, plus anabolism, buildup, equals metabolism. And what you're looking for is you want to be net, your metabolism should be net anabolic. Doesn't matter whether you're breaking down or building up, but you want to be net building, net anabolic, net in the black. In your business, you're going to spend money. You can spend $1 million a year in your business, but if you make $2 million a year, you're in the black. If you spend $1 million a year and you're only making $500,000, you're in the red. It doesn't matter whether you're making $1 million. It matters how much you're spending and how much you're making. Likewise in the body. It doesn't matter. What matters in the body is how much you're breaking down versus how much you're building up. So degenerative diseases are all just a sign that you're more catabolic. You're net catabolic. You're net in the red. Turn that around by building. How do you build? Nutrition is key. Eliminating the catabolic forces is also important. And things like resistance training or stress to drive anabolism. And that's the key to long, healthy life. And if you're dealing with a degenerative disease, which is what most diseases are, that's the key to reversing it. There's no drugs that can do it, by the way. There's nothing. I'm telling you this as a pharmacist. There's no prescription drugs that can turn that equation around from net catabolic to net anabolic. None. No surgical procedures, no doctor's strategies, none. And if you understand what I just said about catabolism and anabolism and the relationship leading to metabolism, you can see why, unless you have a trauma or some kind of severe accident of some kind or infection perhaps, a doctor can't help you. And it's obvious because look, they don't help anybody. They might hide your symptoms, but they're not helping anybody who has a long-term chronic degenerative disease. Do you know the average American is over the age of 60 years old has at least 60% of Americans over the age of 60 have at least one chronic degenerative disease, and 40% of them have 2 or more chronic degenerative diseases. And this is all the doctors and insurance companies and drugs and hospitals and protocols and everything else that we have. Obamacare and all the different health strategies that we have. We're sicker than ever before. So
absolutely, Pharmacist Ben. I'll let Phyllis go. But one thing that we have is super greens is in a powder form, and then there
was one that has a lot of pigments in it. I forgot.
And then the 20 and 18 daily are capsule form. Powdered capsules.
And they have different pigments.
Tons.
That's the one I'm thinking of.
All right, Phyllis.
Pharmacist Ben, we have a question from Deborah in our chat, and she is on the Zoom with us and has her hand up. So we'll get her up here. But she would like to know about type 3C diabetes, or dysglycemia, as you like us to say.
Type 3C diabetes?
And let's get Deborah up here.
That is when the pancreas is damaged and stops working.
Yeah.
Okay.
Go ahead, put Deborah up.
All right, Deborah, there you go. She is unmuted.
Yes, I've been diagnosed with type 3C diabetes. They misdiagnosed me with type 2. And
it doesn't matter. They're all the same. They're all the same.
Okay.
Do you have any history of like cystic fibrosis or cancer?
No. From what I understand, it's hemochromatosis is my.
So there's damage to the pancreas following iron overload, right? Is that what they said?
Right.
Okay. So that backtracks to the liver, which is part of the digestive system. So it's just another digestive issue. Doesn't matter if it's 3C or 3 or type 4, type 1 or type 2. They're all issues of glycation and leaky gut and dysbiosis. And Deborah, I'm only a pharmacist. I'm not a psychic, but I can tell you, guaranteed, that you've had a digestive problem for a long time. Correct?
Yes.
I'm not a psychic, Deborah. I'm just a pharmacist, but that's how it works. So you backtrack you always backtrack, the type 3 diabetes, pancreatic diabetes, or pancreatogenic diabetes, I think they call it. That is the fruit. It isn't going to help you. You can't work at the fruit level. Once that's rotten, it's rotten. Once your fruit is, inedible on the tree, you can't fix it. You got to go to the soil, and you got to go to the root. And the soil and the root are going to be exactly what we're talking about. Your doctor will not tell you this. Yeah, likely he doesn't even know. You got to backtrack to what's getting into the blood. And that always starts off at the level of the intestine.
Right.
Okay, so it doesn't matter. Remember, your diagnosis doesn't matter.
Right.
If it's related to hemochromatosis, that's a liver issue. And if you have a liver issue, chances are you're dealing with metabolic syndrome. And you're dealing with metabolic syndrome, then chances are you've had a long-standing digestive issue because that's behind metabolic syndrome. And that's really how you want to work on it. So number one, work on intestinal health, all things we just talked about. But number two, start doing all the blood sugar stabilizing and insulin stabilizing, because the pancreas makes insulin. So when you have a pancreatic condition, you're going to have an insulin problem too. So are you on insulin by any chance? Did they give you insulin? You're on insulin, right? So insulin is a serious, powerful hormone. And you got to be really careful. It will accelerate aging. It accelerates cell division. It's associated with cancer and weight gain, heart disease. It's a big problem hormone. You need it, obviously. And I'm not sure how damaged your pancreas is, but your goal is to try to use as low a dose of insulin as possible. And the best way to do that is to minimize your intake of fast-burning carbohydrates. You got to lay off of anything that has what they call a high glycemic index, go ketogenic, low calorie, all the things that you need to do to keep your blood sugar stable. And that includes the healthy blood sugar pack, the ultimate niacin, the ultimate selenium, the Fucoid Z. Now, these are all strategies for helping lower blood sugar. Drinking more water, that can help dilute blood sugar. Anything you do to dilute blood sugar will allow you to use less insulin. And then working on the digestive system. Does that make sense?
Yes, I drink a gallon of water a day at least.
Gallon of water a day, absolutely. And always put some BTT in there, or at least periodically put some BTT in there, because water will dilute your electrolytes and cause you to lose vitamin C and the B complex as well. And the B complex is very, very important for blood sugar control, especially B1 thiamine. It's one of my favorite features of Beyond Tangy Tangerine is this high concentration of thiamine. And in my opinion, I know I've said it before, but I'll say it again, in my opinion, thiamine deficiency is one of the great hidden nutrient deficiencies that human beings have. And thiamine deficiency is associated with high sugar intake, because thiamine is used by the body to process sugar. Alcoholism, or drinking a lot of alcohol, will lead to thiamine deficiency. Processed foods will lead to thiamine deficiency. Ingestion of a lot of processed foods can lead to thiamine deficiency. And thiamine deficiency will cause things like mental health problems, psychoses, peripheral neuropathies, chronic constipation, all of the heart issues, cardiovascular issues. All of these can be related to this hidden, very underappreciated deficiency that's linked to excess calories and excess sugar, vitamin B1 deficiency. So you might actually want to take extra vitamin B1. That might not be a bad idea for you.
B1, okay.
Okay.
Okay. Yeah, it's just gotten worse and worse. And,
well, you're going to doctors though, right? It shouldn't get worse and worse if you're going to doctors.
Yes, but the way I found out about the 3C, well, like you said, they're all close, but I'm seeing a homeopathic doctor.
Who told you it was a pancreatogenic form of diabetes? Did you get
the homeopathic doctor?
Did they guess at that, or like what made them say that?
Just by my symptoms.
How were your symptoms different from ordinary dysglycemia? Did you have pancreatitis? Did you ever have any issues of pancreatitis or anything like that?
Not that I was aware of.
So why would they say, as opposed to just, type 2 diabetes?
She just figured that out by like my blood work and stuff like that.
Do you remember what was in the blood work?
Yeah, the blood work I had, and the doctor put me on one insulin. She wanted a different one. Theirs was too high. Actually ended up causing me quite a few times low blood sugars, but my body is just so sensitive to so many things,
Well, when you have that sensitivity, that usually implies, again, something's getting into the blood through the intestine. There are people who like are sensitive to the sun, like they'll go out in the sun and they'll get rashes, or hot water in the shower will give them. They'll take a hot shower and they'll get rashes from the hot shower, or from your bra strap or your underwear belt. What do you the
waistband?
Waistband, yeah, the waistband that can cause rashes for some people. There are some people who can write their name in their skin. You ever hear this? Where you can write your name in your skin and the skin will rise up based on when you write. They call it psychographia. You know what I'm talking about?
Yeah.
Yeah. All of these are classic. You may be able to do that. All of these are classic signs of blood toxicity, particularly histamine. So if you're one of those people who's sensitive to everything, that would imply that something's getting into your blood through the intestine. And everything you're telling me, Deborah, is leading to that. As I said, I'm not a psychic. This is just the way it works.
Right. So the leaky gut?
Yes.
Okay.
Why don't you, are you doing longevity, Deborah?
I am not, but my husband is.
How'd you hear about
And
us? From your husband?
KFI radio.
Okay, so why don't you find yourself a distributor? Becca, let's get Deborah a distributor. We'll work with her.
I do have one.
Oh, you already have one.
Yeah, I have one because my husband uses all the longevity products.
Okay, well now you
But
do it
I
too.
didn't want to start using any of them because of the protocols that my homeopathic has for me. I didn't want it to interfere with anything.
I'm not sure that nutrition will interfere with homeopathy. Homeopathy is a little bit different. So, but ask your homeopathic practitioner. But I find that I don't think that's going to happen. I would doubt that.
Okay. So
Okay. Yeah.
do the protocol of longevity of the blood sugar protocol.
The blood sugar lowering protocols. Yes, we have lots of them. Becca,
Okay.
get in touch
So
with
that's what I should
Deborah.
do.
Yeah, we'll work with you offline, Deborah. But yes, we can definitely help that out. Help you out.
Okay. Okay.
Okay. Thanks for
All
calling.
right.
Thanks for being on part of the call too.
Thank you.
Okay.
Yeah.
All right. Becca, I got a bolt.
Awesome.
I got
Yeah,
another
I know
podcast.
you've got a bolt. Thank you so much, Pharmacist Ben
Thank you.
Fuchs, for joining us here. If I could get my co-hosts on the screen, I couldn't do this without them. As they're
Monday at
absolutely-
10.
I got to talk to you about that, AJ. Let's talk off air. And then everybody, thank you so much, Phyllis and Becca and Marilyn and Albert and AJ. You are a total and complete king rock star. Thank you so much. And thank you all.
All right.
All our wonderful listeners. We'll talk soon.
Thank you, Pharmacist Ben, for being an example of how to be a rock star.
All right.
And Deborah and anyone listening, if you would like to get more information on what can be done to help yourself, you may email us questions at dailywithdoc.com. We will respond to those emails with a nutritional approach, not only supplements to take, but foods to not take and recommendations to help you create a strong, better health journey. So folks, thank you so much for joining us. I am very, very appreciative of my team as they have been keeping the program growing while I was out doing some self-development and time with my family. Want to do a thank you so much, Phyllis, for being here and being part of our team, as she is a pioneer in this area of health and wellness and sharing Dr. Wallach's mission. Thank you so much, Phyllis. We also have Marilyn, who is a great researcher, loves to write. And thank you. I saw yesterday, Marilyn, how you were contributing to the show with AJ and the shortest Daily with Doc ever, but it had some impactful information for each and every one of us. Thank you so much, Marilyn. She's also here. She and Phyllis both are putting information into the chat. So folks, if you're not here live with us, you are missing out on all the information that is shared there in helping you to take notes and be able to recall what is being spoken and shared to take back to the person that shared this program with you. So thank you both. We also have Albert today, who's letting people in. He is our gatekeeper, joining us from South Africa, and also an amazing certified holistic health coach, helping people and helping us to reach people around the world. Thank you so much, Albert. And we have AJ, who has been my right hand over the last few weeks and taking charge and just helping us keep the message going, making things brighter, more attractive. Are you saying that I'm like keeping you prisoner? Was that handcuff movement? What's up with that, buddy?
I'm your right hand. I'm your right hand.
Gotcha. All right. This is a strawberry blonde, folks. Okay, let's just go with that. But I just want to thank each and every one of you for taking this time, investing in yourself with knowledge that you can take action on. So break loose of that story that you have been telling yourself and others for many, many years, and let's take action to help you create a better health journey. Again, this is Becca Duke, certified holistic health coach, certified naturopathic practitioner, and also director of student services for the Institute of Holistic Health. And if you have a desire to learn more and you love to be online and learn on your own time, then that certified holistic health coach course might be just for you and calling your name. So give us a call at 855-949-3377, as my team does have some discount codes to help you save on that program. And you can go to coach.dailywithdoc.com to get more information specifically about the Certified Holistic Health Coach course offered by the Institute of Holistic Health. Thank you so much, everybody, for joining us. Make sure that you go to our website, dailywithdoc.com, sign up for our email so that you get notifications of when we are bringing more empowering information to you, whether it's through Daily with Doc and Becca or Pharmacist Ben Bites with AJ. Folks, you don't want to miss a single moment of being able to feed knowledge into yourself that can truly change your life. So until next time, again, give us a call if you have questions, you want to get started on a program, and you are not working with somebody, at 855-949-3377. Until next time, bye for now.
This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wally. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health. Dr. Joel